Hi, and welcome back to my YouTube channel. My name is Maureen Sullivan. I'm a registered nurse and a certified diabetic educator, and today's video is on something called type 3 diabetes. And I personally was in a class yesterday with several hundred people. It was online, and the people that were in charge and discussing ways to reverse diabetes mentioned the term type 3 diabetes, and many hands went up and looked at each other like, did they really say type 3 diabetes? So I thought I would take today and make a video about type 3 diabetes, what's going on, what does the term mean, how does it relate to the world of diabetes, and most importantly, what can you do, that's right, you and me, to reduce the risk of type 3 diabetes. I will tell you, for this lecture, I do have a lot of information, so if I'm not looking at you, I'm looking down at the papers because there is a lot of research on this, and I think it's going to be a fascinating overview for anybody tuning in. So be sure and like and share, leave a comment, subscribe, tell millions of your family and friends, you know the drill here on YouTube. Anyways, understanding type 3 diabetes. So in recent years, a new term has emerged in the diabetic discussion world, if you will, and that's type 3 diabetes. And I know that everybody listening and everybody that's going to view this video understands type 1 diabetes, understands pretty much type 2 diabetes, gestational diabetes, pre-diabetes, but have you heard of the term type 3 diabetes? And it's talking about insulin resistance as it relates to your brain. And so a lot of times that's not even on the discussion table with your primary care doctor or your endocrinologist. But type 3 refers to a condition where the brain is struggling to properly process your insulin. And so it's causing, unfortunately, several terms come to mind, confusion all the way to dementia, all the way to a link to Alzheimer's disease. And it is resulting from the insulin resistance to your brain. And so it's causing memory issues and thought process issues, and it's causing an increased risk of neurodegenerative diseases. So about 50% of individuals with type 2 diabetes can also experience type 3 diabetes. Now, I don't want you to go, my gosh, that's a terrible statistic. Type 3 diabetes is also commonly linked to the normal aging process. When you think of Alzheimer's disease, you think of people in their 60s, 70s, and 80s. That is where that cognitive decline is happening. To link this directly up to type 2 diabetes is a little bit of a misnomer there, because I want to emphasize properly controlled diabetes, whether it be type 1, type 2, type 1.5, gestational diabetes, your risk of complications are much lower. So don't make it a direct link between type 2 progression onto type 3. The connection, though, about insulin and cognitive function, the brain function. So insulin obviously plays a very important role in getting nutrition and cellular functioning at its optimal level here. It's getting blood sugar into the cells. Think about it, whether it be into your heart, whether it be into your gut, whether it be into your brain, it's all related. So when that insulin isn't working, your brain also has the unfortunate opportunity of not getting enough proper nutrition to function adequately. And so that's where cognitive decline kicks in here. So as we age, we all know we have a higher risk of a lot of older related illnesses, if you will, and that's where this comes into play. I can give you a fancy term, type 3 diabetes, but the issue is it also has symptoms that are often attributed to, well, we're just getting older, we're just, it's part of the normal aging process, because symptoms such as forgetfulness and difficulty focusing on a task and following discussions, and changes in mood and sudden irritability or emotional instability, those could be related to aging process and aging, decline in health and stuff like that. So it's not a direct link, but something to keep in your, no pun intended, in the back of your head, in your brain here, what might be some of the factors at play. So, like I said, these symptoms easily overlap with normal aging. They also overlap, unfortunately, with types of dementia. So what are those risk factors? They're very similar to type 2 diabetes. and that is excessive weight because it's affecting your insulin resistance, that sedentary lifestyle because it's wreaking havoc on your insulin sensitivity, and those poor diets lacking in nutrition and nutrients. Those are the things that affect all types of diabetes and everybody's overall general health. There's also a family history, genetic predispositions, and then that normal aging. If you're over the 65 age limit, and many of us are, that increases the likelihood not only of a chronic disease such as type 2 diabetes, but also, unfortunately, types of dementia as we get into our 70s and 80s and so on and so forth. So what can we do to improve our overall health, our type 2 diabetes, all types of diabetes really, and lower our risk of type 3 diabetes? A lot of this is going to sound familiar, but then there's a section I want to read to you because you're going to have an aha moment. So, as a diabetic educator, a balanced diet. Now, I'm not going to sit here and tell you this diet and that diet is better, but the cleaner the diet, obviously, the better off it is. High in nutrients, nutrient dense, as they say, lean proteins, decreased in refined and processed foods. You know where I'm going with it, folks. Healthy eating, okay? Regular exercise, because you just have to get those muscles working, and activity improves all areas of your lifestyle, including lowering stress levels, improving sleep levels, improving overall muscle matters. Everything matters on that. Regular checkups, because a lot of us don't even know that we're pre-diabetic, we're type 2 diabetic. So those wellness screenings, those preventative screenings, those routine physical appointments with your providers, those are all important just to track where your blood sugar is at, where your overall health is, because everything is affecting, like I said, not only your heart, not only your lungs, but also your brain. But here's a section I want to read to you, because as a diabetic educator, it's rare that I would tell somebody to do the following activities if I was talking to you only about type 2 diabetes, and that is mental stimulation. Think type 3, protect the brain. Engage in activities that challenge your brain, such as puzzles and reading and learning new skills. Studies show that individuals who engage in mentally stimulating activities reduce their risk of Alzheimer's by how much? Up to 60%. Like I said, diabetic educators, nurses were focused on the nutrition and the physical activity and proper sleep habits. It's rare, in my professional opinion, that we sit down and say, keep your brain stimulated. So like I said, as a diabetic educator, I'm excited. Puzzles, reading, and learning new skills, okay? That's really cool. So like I said, this was only meant to be an overview of type 3 diabetes. This is nothing new. It's a newer term being used in the world of neurology and aging and that, but it is, in my opinion, the progression of uncontrolled or poorly controlled diabetes and how it is affecting us as we get older. So, in a nutshell, folks, type 3 diabetes, nothing to be afraid of, something to be aware of, okay? Again, my name is Maureen Sullivan. My website, MaureenSullivanRN.com. Thanks for your time. Leave me a comment or two. Tell me what you're doing to, and I say this seriously, keep your brain mentally stimulated. Have a great day. Bye.